something that we've been noticing over the last decade or so is that younger folks who we traditionally did not think were at risk for developing rectal cancer and colon cancer are actually developing it. In fact, statistically, people born in the 90s are 2 times more likely than people born in the 50s to develop colorectal cancer. And that's remarkably striking. And I'm not quite sure why we know why that's happening. That's really the conundrum. But my message is that people, regardless of your age, you have to not ignore any symptoms regarding the possibility of colorectal cancer. So I think there's several elements to trying to mitigate your risk of dying of colorectal cancer. One is get screened. So that's age 45 for everybody, the general population. Whether you have a family history or not, whether you have any risk factors or not, whether you have any symptoms or not, everyone at age 45 should be screened. So that's step number 1. Step number 2 is please don't ignore any symptoms. Even if you have already been screened or you are below that age group where we would normally screen somebody, any symptom that you have is critically important to get that evaluated. So bleeding, changing your bowel habits, pain, anything that is not normal regarding your bowels deserves a visit to the doctor and a discussion about should I be screened or should I be looked at for the possibility that colorectal cancer is causing this. So that helps us to find the diagnosis sooner and then gives us an opportunity to treat it at an earlier stage. And then the cure rates are higher. And then the third piece is obviously those dietary considerations and the exercise considerations. So maintaining a healthy diet, the same diet that you would be told by your cardiologist or by your medical doctor is healthy, that high fish and veggie diet, that modification of your risk factors regarding your weight and exercise are critically important.
But I think a lot of it is awareness, because we all have seen patients that had rectal bleeding that was, blown off as hemorrhoids or IBS symptoms for a while before they were found to have a colorectal cancer. And the other thing that I would add is knowing your family history is also important.